Dr. Matta.
How are you? Good to see you again.
So great to see you again. So excited to be here to see this new cutting edge technology that you have at your facility.
Yes, we have 4 ladies here today, and we're going to demonstrate each of the technologies. We're going to show you all the things that we can do. We're going to work on some cellulite. We're going to work on some tightening. We're going to work on some vessels, some pigmented lesions, little dark spots on the face. So we've got variety to keep you entertained. So what we're going to do first is we're going to treat a patient for cellulite. And as you know, cellulite affects 80% of women, usually after puberty. And it's a very stubborn, troublesome thing to try to treat. And the best technology we have currently is the Storage CelluPulse acoustic wave treatment.
Okay.
Usually need about 3 to 8 treatments. You'll start to see a result within the 3rd session.
Okay.
And it's generally spaced once a week. Relatively comfortable, no real downtime post-procedure. And follow-up is usually done every 2 or 3 months after that. Because of the chronicity of cellulite, just is a bit of a stubborn bugger to completely improve. So we've applied the acoustic coupling gel, which enhances the penetration of the wave.
Okay.
And the treatment for thighs and buttocks usually takes about 20 to 30 minutes, and it's very well tolerated. It can be a little bit uncomfortable the higher setting we go, but you get used to it. And I guess the expression is no pain, no gain. So
Exactly.
hopefully it won't be too uncomfortable for her, and you get to see exactly how this treatment is applied.
So today we've been talking about emerging technologies. What is this device that you have here?
This is the Maximus, powered by Tri-Lipo, manufactured by Polygen, the pioneers in radio frequency, in multipolar radio frequency.
And what exactly does it do?
It does several things. One is it works on fat, so it's the #1 fat reduction machine. As well, it is a skin tightening machine, and those processes usually take about 3 to 6 months to see maximum benefit.
Is it for specific areas of the body that this machine specifically focuses on, or can it do...
This can be used in multiple locations on the body. Some are hand pieces that are used on the face, and some are hand pieces that are used on the abdomen or larger areas of the body, thighs, belly, saddlebags, areas of concern. Those are the most common areas of concern for women with fat.
Okay, perfect. So I see here we have one of your patients, but they're using a different device.
Yes, this is the Apollo, which is the current state of radio frequency tripolar.
Okay.
And the difference between the Apollo and the Maximus is that the Apollo does not have the muscle stimulation. So it really is very effective for skin tightening. The Maximus has the added advantage of also being used to reduce fat.
Okay, perfect. So what area are we targeting right here?
Right now we're targeting the neck and jowl area, which is a very common concern, not just for women, but for men as well.
Okay.
So we are able to use other modalities such as fillers to try and lift up the cheeks, but even with the fillers, even with all the other procedures that we have, we still need something like the radio frequency to really help stimulate that collagen production. And again, you will get that immediate benefit within 2 to 3 days, and you will get that delayed benefit months later, and people will look in the mirror and see a nicer, sharper angle.
So how many treatments do you recommend or do you need for this?
Usually with the Apollo we do treatments about once a week for 6 sessions, and then it's up to the individual after that as to how much more benefit they want to get at. Yeah, usually we'll do maybe another 1 or 2 a year, and that not only helps maintain the results, but it also helps build upon the results that you've had from previous treatments.
Any pain with this one?
No, you know what? This is what makes us love the Apollo so much.
Okay.
Out of all the radio frequency devices out there, I must say it is the most comfortable. Most people will find that it feels like a warm massage.
Oh, okay, so it's like coming to the spa.
Yes, we've actually had patients fall asleep during the procedure.
Okay.
And it's quite entertaining, but the patients have said, you know what, I really loved having this procedure. Very different than getting needles, where some people are needle phobic, and you know what, I don't really want that. But when it comes to the radio frequency, we haven't had a single person feel any discomfort whatsoever.
Okay, perfect. So we learned about another device today, and following up, we'll be meeting with another client.
Okay, Marcel, this is one of my favorite technologies.
Okay.
It's really cool. Okay, it's a dual wavelength laser that's used to reduce pigmented lesions, which are the dark spots, sunspots that people don't like, as well as broken blood vessels, the little capillaries that people see either around the nose or other areas in the face.
Okay.
And is the best way of getting rid of those blood vessels anywhere above the trunk, and you can use it on pigmented lesions anywhere on the body. So right now we've got Rob, and he's demonstrating treatment of a pigmented lesion, and this is a machine that's made by Iridex, which is the world leader and pioneer in diode technology. So it's a really fun machine to see used, and it's not too painful. Usually when you're doing a blood vessel, there's a little bit more discomfort just around the nose area. But as you can see, Linda here, she's not even flinching, because people are often concerned, is it going to hurt, is it not going to hurt? And you know, on a scale of 1 to 10, it's a very tolerable range for people.
Alright, so I guess we're done with that.
Yeah, you see, it's pretty quick.
Very cool, very cool.
Isn't it cool? I told you I'd like this one. This is a really fun one.
So we have one more to go.
Yes.
Okay, so I guess we'll move into that shortly then.
Sounds good.
Okay, perfect.
Last but not least, I want to show you the Sigmacon Dermablade, which is a fractional ablative erbium laser.
Okay.
And in English, that means we get a nice peeling effect of the skin. We are stimulating collagen production.
Okay.
And there's a little bit of downtime, about 5 days.
All right.
And you'll be a little bit red post-procedure. And within a month, you'll start to notice a significant improvement. And again, that will continue to improve, as with most methods of collagen stimulation, in a 3 to 6 month period. And what we like about this machine, as opposed to other fractional ablative erbium lasers, is it's got a built-in exhaust, which helps to eliminate the ablated content.
Okay, well, perfect. Today was quite eventful. We did learn a lot about the emerging technologies and what you have to offer here at your fabulous facility. So we hope to see you soon again, and I'm Marcella Barrick, and we'll see you next time with Live with Revive.